Upon flying down to Dallas, Texas, I had my pre-op consultation with Dr. Will. We went in, my husband and I came down and we went into his office the day before my surgery was scheduled, and he has a great staff. They were all friendly, they were all patient with me. I had a bunch of questions, so I started drilling them right in the beginning before I even saw the doctor. And then Dr. Will came in, and he's a great guy. He was able to put me at ease about the surgery, which I was very nervous, you know, going in, and it was something new, so I wasn't sure. You don't hear anything about it, you know, you don't have any rumor information. So he sat down with me, he explained everything, he told me exactly what they were going to do, approximately how long it would take, that I would be in and out. And he'd be right there, of course, working on me, and he told me that I wouldn't, you know, I would have to be awake to a certain point. He would give me an anesthetic, but I would have to be able to tell him if he was getting in the right spot here and there. And on the day of my surgery at North American Spine, they made arrangements to come pick me up and bring me to the facility. I had everything that you normally have, you know, when you go prior to a surgery or operation. They did the blood, put the IV in and take your temperature and all that stuff, just like set you up, you know, for the surgery. They took me into the operating room, and I really don't remember a lot after that. I do remember at one point I could feel when he was working on me, and I had to tell him, you know, if I could feel it and where the pain was in my foot. It wasn't anything that I remembered afterwards, you know, as far as the pain-wise. I just remember telling him. And after it was all over with, I was brought back to normal and awake at that point, and I walked out. I went in on crutches, and I walked out probably 95% pain-free. I had a slight limp, still had some weakness in my leg, and he explained to me prior to the surgery that I would probably have to have physical therapy, which I did. I did 12 weeks of physical therapy, but it's a wonderful surgery, and I would tell anybody to do it. It's so worth it, and it's so not intrusive. Before my surgery, I had excruciating pain. It was unbearable. It was hard to walk. I couldn't hardly walk. I used crutches. After I had my surgery, I had 95% of that pain gone. I still had some pain that eventually left after my physical therapy and after just normal moving around. But the procedure in itself, just that 40 minutes on the operating table took away, like I say, 95% of that pain. The day after my surgery, I went for a follow-up checkup with Dr. Will at North American Spine, and he came in and he asked me how I was doing, and I asked him if he wanted to see me dance. And he said, no, I don't want to see you dance, but I felt that good. I felt so much better than I did prior to going in and having the surgery, and I would again tell anybody to, if they can do this procedure, to do everything they can to have it done. Prior to my surgery, Dr. Will advised me that I should have physical therapy after the surgery itself because I had so much damage, and I had to take his advice and his instruction home back to Ohio. He wrote out what I needed. He faxed it to the physical therapy facility in Ohio. He kept in contact with them for my progress to see that I was doing okay. When there was any flaws, they would contact him, and he would advise them and tell them what they needed to do. He was right on it with the physical therapy and the treatment after the surgery. Even though my procedure was 1,000 miles away from home, Dr. Will was there to see me through everything that the post-operation incorporated. He wrote the prescription for my physical therapy. He contacted the facility where I was to have my physical therapy. He did follow-up calls to make sure that everything was working out for me, or if we had a problem there, we could call him, and he was available to tell us what we needed to do. It makes you feel like you're a valued patient. They stay right with you. They keep tabs on you. Even after my physical therapy, and it was probably 6 months after I had my surgery, they contacted me to see how I was doing. And that really makes you feel like you got a great doctor. You picked out the right one.